There are more options available than ever before for non-surgical management of sports injuries. Today, we are visiting Austin, Texas. Dr. Thomas, a leading-edge orthopedist, is leading the way in sports injury medicine by offering minimally invasive solutions that do not require surgery. Although Dr. Thomas can operate on patients, he works hard with his patients to find solutions that are non-surgical. Dr. Thomas's practice has over 20 years of specialized study and dedication to the treatment of sports injuries with non-invasive approaches.
And in general, most of the surgical treatment that I do is kind of like the last-ditch effort. In other words, I always look to see if there's non-surgical management or a minimally invasive injection that can be done to help improve people's symptoms rather than a surgery, because life gets in the way, people's jobs are too restrictive, and I want to make sure we have the best outcome each time.
After talking to Dr. Thomas and his staff, we learned that his team encourages patients to educate themselves and consider all of their options before doing any kind of surgical procedure. The patient gets to participate in their own healthcare, whether it's non-operative or operative management. All treatment options are presented in a clear and thorough manner to allow patients to make educated and informed decisions about their condition.
I feel like his patients leave here better educated with more information. They have the appropriate resources that they need. I think when they hear the term orthopedic surgeon, they think, surgery, but I would say we only do surgery on maybe a very small percentage of our patients. We try to evaluate each person separately and their condition and take into consideration what their life goals are and their plans are. One of the first things we always ask are what do you want to go back to doing? Because our goal is trying to get them back to what they want to do with. We try to provide everybody with several treatment options, surgical versus non-surgical, trying to get them back to their activities of daily living, making sure their quality of life is where they want it to be.
Among the many innovative non-surgical options available, Dr. Thomas is using stem cells. Stem cells are being expanded in medical treatments every year because of their regenerative properties to generate new cells in areas of need. Many doctors are calling stem cells the new medical revolution because it changes the way medicine is delivered and prevents invasive surgical procedures. Doctors are finding that stem cells provide great healing and new growth all over the body, from muscles, joints, hair, and even growing teeth. Today, we are excited to learn how Dr. Thomas is using stem cells for sports injury treatments as an alternative to surgery.
Another injection that has been getting a lot of press recently is a stem cell injection. And stem cells are cells that are generally found in one's fatty tissue, or what we call adipose tissue, or your bone marrow, the hollow part of the bone. And they're the cells that your body makes and stores and uses to regenerate tissue throughout your body in any given time in response to injury. They can regrow kidneys, they can regrow liver, they can regrow skin and hair. In our field, we're trying to see how we can get them to be used to regrow muscle and tendon and cartilage and bone. And so far, we're seeing a really good amount of research showing their potential to heal tissue. And we're finding that if we use some of the stem cells and we inject them in the joint at the site of injury, they tend to act in a way that will help the tissue to heal. And we're hoping to be able to allow tissue to heal without even having to do a surgery on it. Right now, there's some studies that are being done across the country looking at people that have arthritis that would normally go on to need a large surgery like a knee replacement or knee arthroplasty, and trying to find ways to use stem cells to keep them from needing that surgery. The studies so far are showing that there's a trend toward people having much less pain, much increased function, and a much longer time frame of needing to have a surgery when they initiate that treatment.
Sometimes when our patients come in and see Dr. Thomas, and they are hoping that they're not surgical candidates, that we could do some non-surgical procedures like the PRP and stem cells, and sometimes that's just not possible. So we do a lot of surgeries, and with the surgeries, then while we're repairing a site, whether it's a rotator cuff, ACL, meniscus, we like to use PRP with the stem cell to help the healing factors of those type of repairs.
During our visit, we learned that Dr. Thomas is passionate about sports and staying active. Having an active lifestyle himself, he values and understands patients who want to remain active during the course of their life. Dr. Thomas offers a large range of non-surgical solutions such as stem cell treatments and visco supplements, but also does surgical procedures when necessary. We found this offers patients better healthcare options with their sports injuries, allowing the patients to find the best solution for their needs.